Today we have Alice Stewart with us. She is a board certified art therapist with Intrepid Spirit in the Department of Brain Injury Medicine. And we're just really glad to be able to talk about art therapy. It's been used in so many different disciplines and disabilities over the years. After a brain injury, functionality might be changed, making, being able to express yourself or doing activities that you once enjoyed more challenging. And so using that creative expression to help as an outlet for both mental or cognitive help can be really great. And then being done with an art therapist is just a better way to, use the healing process and help with rehabilitation. So without further ado, I'm going to turn it over to Alice and we're going to talk about art therapy. Thanks so much.
Thanks so much, Lauren. I'm super excited to be here this afternoon. I'm very passionate about what I do and helping others through it, and excited to share some of that with you guys today. So my name is Alice Stewart. I'm a board certified art therapist, and I'll get to what that means in a few moments here. But first, can you guys see my screen? Is my screen changing for you?
I see it, but it's not changing. Are you click like the furthest to the side, like where art therapy is, maybe click that and see if it changes.
There we go. Okay. So our objectives for today, just defining art therapy, go over a brief history of it. Where did it come from? A lot of misconceptions out there of qualifications for an art therapist, and then going into some benefits of it. Right now I'm working specifically with the military population, so talking a little bit about that. And then I have an experiential, so you guys can get a little feel of some art therapy and doing that for yourself today. One of the first things I always like everybody to think about is, what do you think art therapy is? So in your mind, coming to this presentation today, what do you think it is? Sometimes I get some generic answers of, oh, it's just for kids. Oh, it's just arts and crafts. And those are some common misconceptions. Some other terms that you might hear too that further confuses things is you have art therapy, then you also hear creative arts therapy, arts therapies, expressive arts therapies. So creative arts therapies is the umbrella category. It's also known as arts therapies, in that art therapy is one, and then you have music therapy, dance movement, poetry, and drama therapy. So they're each their separate categories. Expressive arts therapy is slightly different in that it is training and education in a little bit each of those arts and using all of those. So treatment-wise, being an art therapist, visual arts is my main modality that I use. We're governed by the American Art Therapy Association, so this is their specific definition. But when we're looking at art therapy, it is another form of behavioral health in that we're using the visual arts as a form of self-expression. Now, each art therapist works a little bit differently. And it's not to say that we're all only nonverbal. There's also some verbal processing that goes on too. So how did art therapy begin? Art therapy has been around since the 1940s, but as human beings, we've expressed ourselves through art since the dawn of time. In the 1920s, Carl Jung and Freud used art in treatment. And then in the 1940s, kind of simultaneously in Europe and the US, it started popping up more and more in treatment and coming together as a profession. So in the UK, it was Adrian Hill. He, for them, is known as the father of art therapy. He was an artist in World War I and had TB. So when he was in the hospital with his illness, he used art to kind of cope with his feelings and his emotions and express himself and his frustration of where he was at. In the US, we had the mothers of art therapy, which is Margaret Naumburg and Edith Kramer. And that kind of started the split in art therapy originally of this art psychotherapy versus art as therapy, because Margaret Naumburg studied under Freud and was very much about the psychoanalysis of art. What does symbols mean? What do colors mean? Edith Kramer was more of the therapeutic nature of art itself. So creating art is just therapeutic in and of itself. So she focused more on just the process, not so much the product. And today we combine both. We're looking at more of, what is the person doing the art, what's their meaning in it, and the therapeutic process of making that art. An example I like to use all the time is the color red. Some people might say, oh, well, red means anger. Red means love. Red means happiness because it's their favorite color. Red doesn't mean anything because it happens to be the random marker I grabbed that day. So working with the individual really to find their personal meaning in it. And then in the bottom right-hand corner, I included the art lady off of Mr. Rogers because she was actually an art therapist as well. That's Judy Rubin there. So that's an art therapist that many people can recognize without even knowing she was an art therapist. So to be an art therapist, we have to have our master's to practice, master's in art therapy from an accredited institution. To get into a master's program, we have to have so many credits worth of psychology and so many credits worth of visual art. Some of the graduate level coursework is listed there. We're doing theories of counseling and psychotherapy, ethics, assessment, evaluation, how to do art therapy in individuals, groups, families, development, multicultural issues, research, all of that. Part of what we do is also then our practicum experiences in a supervised setting. Most programs require at least 800 hours, some are a little bit more. And then also a master's thesis to graduate. So for myself, I've been in practice about 9 years now. I worked in inpatient psych for about 6. And then I've been here at Intrepid Spirit at Fort Bragg for, this is my 4th year. So about 3.5 so far. I've worked with individuals as young as 3 and as old as 98, kind of run the gambit of mental health issues, and also dealing with addiction, dealing with chronic pain, dealing with the effects of long-term physical illnesses. Some images for you guys, some of the stuff that we learn and study. So the different stages of drawing that everybody goes through from when they're an infant to adolescence. The different levels of processing with art therapy that you can move through, and the continuum of art materials. So when we're looking at this, how I work with an individual depends on where they're at and what's going on. So I might have a session that is super structured or wide open and anywhere in between. So super structured is the experiential that you guys will get to experience later, will be an example of that. Kind of in between is a theme, so it gives a place to start. So not, the person in front of me or the group in front of me isn't looking at a bunch of art materials going, I have no idea what to do. And then the wide open is if somebody comes in with something that an image they want to create or a material that they really want to explore, then they're the driver in that, and that they can just go into it and create. So I said we're governed by the American Art Therapy Association, which is ATA for short. We also have our art therapies credentials boards. I'm a board certified art therapist, which is the highest credential an art therapist can earn. So after we graduate, we have to do so many hours that are art therapy specific with clients that are supervised to then become a registered art therapist. That's the ATR. Once you have your ATR, then you're able to sit for the boards to pass that test. to show your knowledge and clinical skills before being able to become board certified. A few years ago, ADA also added on the ATCS credential, which is a certified supervisor credential as well. Besides going through and earning our credentials, we also have to do so many credits of continuing education to keep up our credentials as well. In terms of licensure for art therapy, it's a little bit different depending on the state. This map shows currently the states. So the states that are in that gold color are the states that have art therapy specific licensure. States in the teal, they're under a related license. Purple, they recognize the art therapist title as a protected title. And then the states in blue are currently seeking to get the art therapy licensure established. So North Carolina falls into that final category there, where the Art Therapy Association of North Carolina is really working to get that passed so that we can recognize our credentials as licensed within the state. I was originally from Pennsylvania. In Pennsylvania, which is that teal color, it falls under an LPC, a licensed professional counselor. So once you pass your boards, you're also able to do the paperwork to have your not only your ATRBC but also your LPC on the same thing. So how is art therapy different from other approaches? The three things that set art therapy apart from, say, your traditional talk or verbal therapy would be use of art material as a means of expression and communication, the multiple levels of meaning that are present then in the product, and then the therapeutic effects of the creative process itself. A lot of times we don't have the words that we need to express what's going on. And sometimes the art, has that ability to convey that in a very powerful way. A quote there on the bottom that I like from another art therapist just says, art therapy works by listening to yourself through the art. Even when we're making a doodle and we take a step back and look at our art, we can find a lot of personal meaning within that art. So how is art therapy helpful? On the slide as well, I have some artwork there from patients of the past who have given me permission to share their art, and some of it we'll talk about a little bit later. So art therapy can improve your focus, improve your fine motor skills, cognitive functioning, organization, decrease anxiety, stress, increase relaxation, improve your overall quality. So we just have some of the benefits around it. Another one of the big questions I get is, well, when to consult or refer someone to an art therapist? A lot of times, if a client is expressing themselves more easily through visual images, then we're going to be the one to work with them in therapy. If a client is very guarded or apprehensive to traditional verbal therapies, I like to call the art therapy a sort of a backdoor where it takes the pressure off to have to talk about something and allows them another way to express themselves, which then easily starts to open somebody up. Because now they're talking about the piece of artwork in front of them. It gives them distance from it rather than talking about themselves, even though they're still talking about themselves. If you have a client that is experiencing intense emotional reaction or affect during or after an art process, if a client has trauma that happened before they were verbal, if a client is creating artwork with you and it is disturbing, or you have questions about how to respond to the artwork. If further information about art therapy or the therapeutic art is desired. Keeping in mind staying within scope of practice if you're a provider. For us as art therapists, we not only study psychology, but also visual arts. So, painting, drawing, sculpture, all the different materials. So we have a working knowledge of a large a large array of art materials. And not only that, but then what those art materials can do. You know, I showed you that continuum of art materials and that we have our restrictive and more fluid. If somebody is feeling out of control and you're trying to give them something like paint, it may have a negative result in that it's too out of control. Giving somebody like that a more controlling medium like pencils or markers or color pencils might be more helpful. So we have a knowledge of that already. And I included this disclaimer at the bottom here because when I do my documentations, I include this disclaimer in it. Artwork can be very helpful in describing issues or sharing thoughts with other providers, but it should be coming from the patient. So if you have somebody that is seeing an art therapist or other creative arts therapists, you know, their artwork may be really good insight into what's going on, but it should be up to them if they want to share and talk about that with somebody else. Big thing that I've seen happen in the past is a misinterpretation or judgment of the artwork doing some damage. Or somebody meaning really well saying, oh, this is a beautiful piece of art, and not realizing that piece of art represents a very traumatic experience that the person has and really isn't beautiful at all to them. So like I said, I currently work at Intrepid Spirit, which is the concussion care clinic here on Fort Bragg. Today, the two of the biggest things that have hit active duty soldiers are going to be PTSD or TBI. You know, one the other, a little bit of both. They come from traumatic experiences. They have some overlapping symptoms, and they're the invisible wounds of war. So just some facts about TBI and PTSD. Large co-occurrence between the two of them. Studies have linked TBI sustained to deployment to significant predictors of developing PTSD symptoms. Both of these are very individually complex, and then the effects are just exacerbated when they occur together. They leave internal scars because they affect, you know, cognitive, physical, behavioral, social, interpersonal, emotional areas. So it affects the whole person, but they can't be seen readily. Art therapy, in its nonverbal nature, being able to express yourself through the arts, it allows individuals to be able to make these internal struggles tangible and real, something sitting outside of themselves, to begin to heal these wounds. When we talk about a traumatic experience, you know, those memories are coded differently in the brain. The Broca's area of the brain shuts down. So trying to put words to them and trying to verbally just share them, there's a block in the brain. With art and the nonverbal component to it, it allows a person to start processing that in a different way, and helps create the verbal language for it to then be putting it into the memory process where it's stored properly. So following TBIs, individuals may experience, you know, poor self-concept, decreased self-awareness. Going through a TBI, you know, the aftermath, the effects of who am I now, limitations, what can I do, what can I do? So art therapy provides a structured environment where, you know, you can express that and contain that and explore, well, who am I and who do I want to be? Who was I that I still want to have and can have versus what would I like to leave behind? It also allows a chance to build a sense of purpose. You know, gain social support, especially when in that group setting, aid in that emotional exploration, change that perception of the illness and of what's happened. One of the big things with art therapy is it helps with neuroplasticity, the ability for the brain to create new neurological pathways. So art making in itself helps to spark and support creating those new pathways. I talked about it earlier, you know, in my practice, I want to meet my client where they're at. Depending on how severe the TBI was, Most of our patients are in the mild category, but we have had some that are more that moderate to severe. But meeting the person where they're at and what's going on, what are their concerns? So some examples here, somebody in an early stage, which is also true for psychological trauma, your executive function is going to be taxed. So something that's going to create a sense of soothing and safety is going to be established through that art experiential. So something that doesn't need the cognitive brain and can take that offline and just focus on the sensory experience of the art itself. Another example, when the frontal lobes have been affected, help with organization and problem solving and memory can be helpful. Kind of across the boards, when somebody's coming to me who I haven't met before, I want to create a sense of safety. I want to give them their power back, their sense of control, and engage whoever I have in a meaningful way. So this is some of the examples of art that have been created by those that have had mild TBIs that have come to see me. The image up in the top left corner, this individual described feeling like an egghead because of the cognitive impairments, forgetting things, having trouble with names, showing up to things later, not showing up at all. So they created this mask to represent this egghead concept. For them, it actually ended up becoming a theme throughout their work to come to terms with the changes and what was remaining and how to work around with it and how to gain those compensatory strategies and move forward to where, the egghead mask in this situation was felt and seen as a very negative thing for them, where it became a very positive, empowering representation at the end. The mask next to that is blue and green. It has some stitches on the head and the mouth. This is one that I included in here because I see a lot of these symbols when doing the masks a lot. So the stitches over the head represent the TBI. The stitches over the mouth represent not being able to talk about things, whether it was the emotional aspects, what they've seen and what they've experienced, the physical aspects that came with the TBI. And then the patch over the eye is seeing and experiencing things that they're not allowed to talk about, or shouldn't have happened, or shouldn't have seen, or feeling those ways. The two masks on the bottom, again, right, mouth is covered or creating I want to be and show happiness to others when really I'm feeling just down and dark and depressed underneath. And I don't want others to see what's going on. I don't want others to think there's something wrong. The cluster of images on the right there comes from a mask that's also a sculpture and interactive, and that front mask you can lift up to see more. But you have the cogs on the side of the head for that memory dysfunction, word searching trouble, connecting mind and speech. The spike in the side of the head is just this pain, this constant stabbing pain that they were getting in their one ear. You have the little glass. It's hard to see in this photo, but there's glue to represent fluid in there, and that they were getting some fluid feeling on the ear all the time. The little red gems are pressure points or pain points when migraines would kick in or headaches would kick in. You have the swirl of confusion. And on the back, there's a little army guy that's being pulled in all these different directions because, life still goes on. You have work, you have family, you have obligations, and how do you work through all of these things, post TBI, and as you're working through all the emotional issues and physical issues that can come with that. Some feedback I've gotten from those that have come to me for art therapy. So most of those individuals that get sent to me to do some art therapy have never heard about art therapy, or have heard about it and don't really know what it is, or think it's just for kids, or think it's just some arts and crafts. and are really hesitant and kind of guarded about it. When they come to me, I ask that they just keep an open mind. And once they experience an art therapy session, it's when can I come again? This is so helpful. Many people find it very relaxing, relieving stress, relieving anxiety, um, feeling that it helped alleviate their depression and improve their self-esteem, their self-concept, their identity. Um, Moving from where I was at, where I want to be. Many have found it very helpful and useful. Just a slide there of some of the references for using art therapy within the TBI military population. So I want to take some time to give you all a chance to experience doing, I call them directives, a directive within art therapy. This is if you have any drawing materials available, just a piece of paper, if you have a pen, a pencil, markers, colored pencils, oil pastels, chalk pastels, whatever you have on hand. So I'm going to give everybody a minute if you don't have that with you to kind of gather those materials. So the directive, the experiential that I've chosen to do today is a guided imagery with art. This guided imagery, if you haven't done any guided imagery before, is kind of like listening to a story. And at 4 parts of the story, you stop and make an image about what you would do in the situation. If anybody here has ever been around art therapists, they hear it a lot. It's all about the process, not the product. So I give you some time to work on those drawings in between, but not a whole lot of time. So it's not about making, this perfect image. It's about getting your idea out there. There's no right or wrong, and the more you trust your gut in this, the more it will make sense at the end. So this particular guided imagery was created by an art therapist by the name of Don Jones. Each image has a general meaning behind it, and I will share that at the end, where it gives you a chance to kind of reflect and find your own personal meaning in your images. With guided imageries, if you are comfortable closing your eyes, especially if you're in an environment that you can do so, it helps you to get that visualization more, but you don't necessarily have to. As we go along, you'll notice that each section becomes shorter, and that's just how this particular guided imagery is written. Again, no right or wrong with your answers. You want to go with your gut instinct. I've had a lot of creative answers, and just representing it visually to the best of your ability. So if you're sitting here going, I don't know about this, I'm not an artist, you don't have to be. Just the best that you can. And if you feel like you need to put words in there to help explain something, that's okay too. And it's meant for you to express what you need to, so that you know what's going on. All right, so once you have a piece of paper, I'm going to ask that you fold it in half both ways so that it gives you, or draw a line down and across, so it gives you 4 different sections on your paper to create for each image. As I read the guided imagery, it will tell you when to pause and make that drawing. And like I said, I'll give you guys a couple minutes in between to work on those. At the end, I'll talk about the meanings behind it, the general meanings, and I have some patient examples to give you some examples to then help you contemplate what do you think your personal meaning is. Lauren, we have any questions coming up so far on the experiential section?
No, I haven't seen any come in, so assuming I've got my paper folded, I'm ready.
All right, thank you. All right, so again, you can close your eyes if you feel comfortable. All right, so I'm going to ask everybody to imagine yourself at home or wherever your stuff is. And you're preparing to go on a journey, a backpacking trip. You are putting into your backpack everything that you will need for this journey. At any point during the journey, you can take and use things that you've put into this backpack. What you need will be there. You will be taking this journey alone, but you will always remain safe. You are physically capable to take this trip, and it is a fall day. The sun is out and there's a slight breeze. It's an excellent day to take this journey, to just get away. You get into your car and head out into the country. You stop at a field. You park and lock the car. You put your backpack on and start heading across this field. You can feel the sun on your face and feel the breeze. You smell and see the many things in nature around you. You cross this field and enter woods. There you find a path. It seems that the path was there just for you, and it's a very clear path. You hear the sounds of nature as you're walking on your path. The sun glitters through the trees and hits your face. You hear the sound of water. As you continue down your path, the water sound becomes louder and louder. Soon you come upon a fast-flowing, deep river. Now the path that you want to continue on continues on the other side of this river. What do you do? This is where we're going to pause for your first image. So in one of your rectangles on your page there, creating to the best of your ability your response. What would you do? You're walking through the woods, you just came to a river that is deep and fast flowing, and you want to continue on the path that's on the other side. So let's take a couple moments to work on drawing that image. Like I said, keep in mind, it's not about the image, it's all about your thought and your process behind it. So to the best of your ability, using lines, shapes, colors, words. I'm going to work to get your idea out there, trying to include as many details as necessary. Let's take about another minute to try and finish up that spot. Okay, let us continue the journey. You find yourself on the path again. As you are walking, you are finding that the path begins to change. You are finding that you have to climb over stones, but the path is still there. Soon, you realize that you are in the foothills of a mountain. And as you continue on this path, you go higher and higher into this mountain. You soon are able to look back from where you came. As you continue on this path, the path becomes more narrow. But you're still able to safely go on this path. It is still clear enough. To the right of you is a drop off, and to the left a cliff going up. You continue on. As you look up the path, you see something coming towards you. As you get closer, you see that it is a goat. Now the goat wants to come down the path, and you want to go up the path. What do? This is going to be your second image. So now you're up in the mountain on a narrow path with a goat that wants to come down the path, and you want to continue up the path. Again, no right or wrong answers here. Go with your gut, drawing it to the best of your ability. I know this drawing of being up in the mountain with a drop off on one side and a rock wall on the other, trying to get up this path, can be difficult to draw perspective-wise, but just the best that you can. Again, with lines, shapes, colors, words. And take a couple minutes. It'll take about 5 minutes to work on that one. As you're all working, the one thing I am missing being in our virtual platform is getting to walk around the room and see everybody and the wonderful artwork that guys are working so hard on. This is a nice chance too, if you happen to finish this image a little bit quicker and wanted to add some more details to the first, to go back and do that. Keeping in mind the image does not need to be perfect. Just getting your idea out there. All about that process. I'm going to take about another minute to finish up if you haven't done so. All right, let's continue this journey. You find yourself on the path again. You continue going up into this mountain, and it's getting late in the day. It's really too late to go back down the mountain. It begins to rain. You realize that you need a safe and comfortable place for the night. You seek such a place as you continue on your path. You come to a clearing, and in the distance, you see what you think looks like a cave. You tell yourself, yes, that would be a safe and comfortable place out of the rain. As you near this cave, you discover that there are two monsters outside the cave. You want to get in the cave. What do you do? This is where we're going to pause for image number 3. So now you're up in the mountain, it's getting late in the day, it started to rain, and you want to get inside this cave, but there are two monsters outside the cave. Again, no right or wrong, trust your gut, whatever that may be. Using lines, shapes, colors, words if needed to express what you would do. Take a couple minutes to work on this one. Working to draw what you would do with your cave and your monsters. you happen to finish this image already, you can always go back and add some more details to the first two. If you did not get to finish those. I'm going to take about another minute to finish up this one. Let us continue the journey. For your final image, you find yourself in a cave. You do find that it is safe and comfortable. You may have even started a fire and are sitting looking out at the rain coming down. You feel safe inside this cave. All of a sudden, a sensation or feeling comes over you. It is the sensation or feeling of I'm not alone. That's your final image. So you're in a cave, got a fire started, watching the rain come down. You get that gut feeling like you're not alone. Again, no right or wrong answer. And focus on what it would be, what you would do, a combination of that. Using lines, shapes, colors to the best of your ability once more. Take a few moments to work on that before we talk about these. As you're working on this last image, if you did not find yourself in a cave and found yourself in some other environment, can still have the same concept apply, just feeling that you're not alone in that environment. I'm going to take another moment or two to try and finish up that image or add some last moment details. So at the beginning of this, I said that each section in this guided imagery has a general meaning, and that there are some, working to find your specific meaning behind it. I'm going to kind of go through each image, starting with the first one, and talk about what that general meaning is. And I have some examples from the past that I can show all of you, since we can't see each other's art, not being in the same room. But if anybody wants to share their answer, what they did, go ahead and throw it in the chat box there. So we started this journey, walking through the woods, and we came to a river that was deep and fast flowing. And you wanted to get to and continue the path that was on the other side. The general meaning of this one, let me backtrack for a second. So as we talk about these meanings, one, they're very personal to you. Two, where you're at today, what you're feeling, what you're experiencing, all of that is going to color your answers. So if you were to do this a couple weeks, months, years from now, you could have completely different answers. Sometimes when you're looking at what the specific meaning is for you, you get that, yeah, this is really me, hits it, head right on the nail. Other times it gives you some food for thought, or brings up something that maybe you didn't recognize. Maybe it's positive and good, maybe it's not so healthy. So it gives some food for thought of, if it isn't so healthy, is this something that I want to work on? Is this something that is good to be aware of, but right now I need to put it on the back burner? And should anything come up for you guys as you worked on this that you want to talk about, I have my contact information at the end that you can always reach out to me as well. So our first one, where we're going with the river that is deep and fast flowing. The general meaning here is how you handle problems or obstacles that come up in life in general. So the example image on this one, this person chose to find a place of the river where it wasn't so wide, wasn't so deep, and try and swim across. Give you guys some other ideas. This person on this image kept walking down the side of the bank until they found an alternative path, maybe a really narrow piece or bridge to cross, or maybe somebody else had already created a path. This person, a little bit harder to see, but they decided to wrap up their backpack in a waterproof bag that they had and swim across. This person threw their backpack across first and then tried to dive right in and swim across, so none of their things would get wet. This person wasn't so sure how to cross the river, so they took some time to just take in the nature around them. Here we have a person chopping down a tree, or thinking about chopping down a tree to create a path, or possibly looking for where there was some stones that would be a natural path. So with this, I get lots of different answers. To give you guys some ideas of how to start looking into, well, what does my answer mean for me? Somebody who is deciding to jump right in and try and swim across, there's some risk to that. Are they looking for that quick solution to solve that problem to move forward, and not really thinking about, well, what are the consequences here? What are the risks to what I want to do? Because in the case of the image, the river is deep and fast flowing. In these, whenever you use your backpack, the backpack is kind of symbolic of your resources that you already have, your resources, your knowledge, tools that you already have in your tool belt. So when somebody is using those tools, it can mean, that you use your own personal resources and knowledge and past experience to help you solve these issues. So for example, with the image that's still up, the guy thinking about chopping down the tree, he took the axe out of his backpack. So that's using one of his resources to help solve this issue. In trying to find other things in the environment, you're looking for additional resources, whether in this case it's the stones to get across, or another path, or something else that may help you to solve the problem to get to the other side. That can be that meaning of finding help in your life to solve this problem. Maybe the problem you're not really sure. Maybe you go to somebody else for some advice. Maybe you go to a professional person to talk about the issue. Whatever that help may look like for you. Other things like if you're going to chop down a tree, that's going to take more time to solve this issue rather than, compared to like jumping right in to swim across. I've also had individuals not get across the path. Maybe like that one here, where they weren't sure what to do. So they decided to be mindful and just take in the sunshine and the nature around them, and take a break. I've had others that have decided to turn around and go back home. They never made it across the river. So sometimes that could be either one of those. Could also be some meaning towards avoiding this issue, or feeling like the issue is too big to solve, or not, or so overwhelming you don't know where to start or what to do. I've also had a few times where an individual never even left their house. The beginning of this is talking about packing your backpack and what would you include in it to go on this journey. And I actually had somebody who was packing their backpack in the garage, and the garage only had, maybe a 2-inch space of it open. So really being guarded, and not wanting to move forward. Going back to our first one. So go to the second image. This is now where you're up in the mountain. The path has gotten more narrow. You have a drop off on one side and a rock wall on the other. And good old Mr. Goat wants to come down that hill. And you want to go up it. So what do you do in this scenario? The goat itself is symbolic of interpersonal relationships. So relationships with family, friends, coworkers, that sort of thing. And as a whole, how do you handle problems or obstacles that come up in those relationships? So these I've gotten a lot of different answers to. I've had some people decide to throw the goat off the cliff. I've had some people kill the goat. Some people try to bribe it with food. Some people are climbing up the rock wall to let the goat go by, or laying down for it to walk over them, or going all the way back down the path to let the goat pass and then going up the path. So I've gotten a lot of creative answers. This person here was trying to decide, is this goat a friendly goat or an angry goat? Because the response is going to depend on the goat itself. So symbolically, that could mean when an issue or problem comes up in the relationship, seeing how the other person is responding first, and then for them, they respond in the same. So if somebody was coming at them, they felt aggressively, they would meet that with aggression. And then the conversation comes into play. Well, if that is healthy or unhealthy, and how do we work on that? This person is trying to scare the goat, clapping hands, making loud noises, like, goat, just go away. I don't want to deal with you, type of thing. So they're working to solve this problem, but they're also doing it from a distance. In a way, loud noises to scare the goat could be seen as an aggressive act, but may not be. This person here chucked the goat right off the cliff. Goat's in my way, I'm gonna chuck it off. It can do its thing, I'm gonna continue on the path. And this person talked a lot about anger and aggression coming out at the drop of a dime when issues came up, especially in relationships. This person chose to climb up the side of the rock wall to let the goat go by. I talked about climbing up the side of the rock wall, or laying down, or going down the path. A lot of times those can mean more passive ways of communication, right? I don't want any confrontation here. I'm going to just let the goat do its own thing. I can pause, and then once it does, I can go on my own way. So in the sense of that relationship of, okay, so-and-so's mad at me, I'm just going to see what they're doing, what they want, let them have their way, and then I can continue on with what I need. This person was hiding from the goat. They were trying to really scoot themselves up right to the rock wall. In their mind, they saw the path being big enough that if they did that, the goat could still go down, and then they could go up once the goat passed. But wants to be aware, not really sure is this goat mean or friendly either. This person, I don't know if you guys can see the little stick figures, got some food in their hands. They're trying to feed the goat. Food coming up into this one too can go a couple different ways. Is it a bribe? Is it trying to get the other person to see your side of things? Is it a distraction? Like, I'm going to turn your attention over here so you're no longer focused on what's causing the issue. I've had people also kill the goat and take the goat meat to either eat themselves or have as a resource later, and we'll kind of talk about that in a later image. All right, going back to our first image here. The next image is going up. Now we're getting further up into the mountain. It's getting late in the day. It's starting to rain and you're looking for a place to stay. So in this one, you find a cave, and outside the cave, there are two monsters. This is where the story changes a little bit, and that people are like, monsters, where does monsters come from? So some of the things we look at are, did the person depict two monsters? Did they depict more than two or less than two? The monsters in this one are representative of internal issues, right? Sometimes we say are internal demons. So as a whole, it's how you're handling or not handling those issues. So again, with two monsters being outside the cave, sometimes I have people turn around and go and find a different cave or pitch a tent or create some other form of shelter, which could, symbolize that avoidance or not wanting to confront the issues in the moment. I've had people try to distract the monsters, throw a rock in a different direction, or avoid them by crawling up the cave and kind of lowering themselves down behind the backs of the monster into the cave, which in both of those scenarios, it's solving the problem for the moment, but not in the long term, right? Because it's not getting rid of those monsters. Others have killed the monsters here. A lot of times that ends up taking on a little bit more positive meaning in that it's trying to solve that issue quickly and move forward. I've had others try to talk to the monsters, try to understand the monsters. Are you friendly monsters? Are you here to hurt me? Like, what's going on? What's your deal? So the monsters, that could be internal talk, trying to understand, well, what's my problem? What's going on? Try to understand yourself. With having more than two monsters or less than two monsters, same with the river in how wide it is. Is it so wide that it looks like a lake rather than a river, or so narrow that it's really a stream rather than a river? Both of these can bring up some minimizing or maximizing. Am I making a mountain out of a molehill with this issue, or am I making it seem like it's no big deal when it really is a little bit bigger than it is? So that can come into play with both of those issues. This person was freaking out that there are monsters, saw them as very threatening, was kind of just stuck in that frozen response. We talk about the flight, fight, freeze. They were in the freeze to this conflict, so not really sure what to do. This person was full-blown camouflage, ready to go back into skills learned and take those monsters out, and being smart about it in that, tactically, how can I take them out without me getting hurt? So we talked about too in a little bit of trying to understand the issues before taking them out, and then solving those issues to move forward. This person did the whole sneak up the side to get on top of the cave, But rather than dropping themselves into the cave, they have a giant rock that they're getting ready to throw on one of the monsters. They saw the monsters as kind of these little goblin things. So if they could take out the one, then they had better odds to take out the other one on one. This person, when we talk about monsters, all of a sudden in a hiking trip, they made it something realistic. You might come across some snakes. Not everybody's a fan of snakes, so their monsters are snakes. They're trying to move the stakes and take care of it that way so that they can get into the cave. This was somebody that's comfortable around snakes and has moved many of them, so it wasn't a challenge in a sense for them. This guy was killing one monster with an axe and shooting the other. Obviously, one might say a gun might be quicker than an axe. So maybe one issue is easier to solve, while other is going to take a little bit more hard work. So some concepts like that. As we're running short on time here, our final one. I will say the general meaning in this one sometimes works and sometimes doesn't. This is the one where you're in the cave, any cave, or if you found yourself in a different environment in the third, whatever environment you drew for yourself, and you got that gut instinct like you weren't alone. The general meaning is supposed to be who or what you place your trust in. But if you are somebody that is just out in nature, and natural things that might pop up in a cave could show like a bear or a bat. If you have a true fear of getting that feeling like you're not alone, your fear might pop up here. In who you place your trust in, if you're a very spiritual person, God, an angel, your beliefs, something spiritual might come into play in your image. This image that's showing on screen, it was that feeling of somebody's there in the back. You see the little red eyes, watching them, not sure if they're wanting to do harm or not. So we talked about with this one, them placing trust in themselves to protect themselves if this is someone or something wanting to do them harm. This person was very strategic about where they're placing the fire itself. I don't want to draw more attention to myself. I want to be able to see the cave opening though, so I can see what's coming in, cleared the cave beforehand. So a lot of times if I have somebody that is dealing with some PTSD symptoms, those symptoms will come out in this one. This person's solution ended up taking creative twist in that originally they were going to draw a bear in the cave. And it turned out instead of a bear, they felt it looked more like a wolf, and they have always wanted a white wolf as a pet, in theory. So it turned into their ideal pet white wolf that was friendly, that was supportive, and they were going to hop on the back and be able to continue on the journey together and supporting one another. This person, another person who placing that trust in themselves. They absolutely cleared the cave, had their back to the back of the wall, looking out at the front, checking things out, and definitely going to protect themselves. You'll also see the head of a monster here because for this one, another monster came back. And that's another thing that is common in this image, in that if you don't deal with your monsters in the first, in the previous one, they can sometimes show up in that, you're alone with your own thoughts, so your own issues coming out to the forefront. The goat can also come up into play in this one, and that could be trust in family or friends. I talked about sometimes people kill the goat and take the goat meat with them. Sometimes that will come back up in this image, as well as the other one, kind of feeding the goat meat to the monsters, sacrificing relationships to internal issues. Could be a possible meaning there, or just reflecting back on those lost relationships too. Another just kind of ominous red eyes in the background. The eyes there too with that theme. Overall, we're looking and talking about is this person able to have an answer to each one of these? Did they get stuck somewhere? Are they using their backpack, their resources, or not? Did they forget about that? Detail wise, at the beginning, this was a fall day with the sun shining down on your face. You have the rain later on that comes into play. So were those details ignored and forgotten about, or are they here? And you can take it into a lot deeper levels of looking at those personal meetings. The other thing that I like to do personally with this one is that being it ends with getting that gut feeling like you're not alone, especially for those that it's not a positive feeling, it's a negative feeling. I want to ask the question of, where would you go from here? How would your journey continue? How would you end it? To see where they would take it and try and turn it around into something more positive before they would leave the session with me. Um, so hopefully you were able to create an image for each one of those and start to reflect a little bit on what it might mean for you. Um, got a couple minutes left. Are there any questions, comments, concerns coming up in the chat? Or if anyone has any, please feel free.
Yes, please take this time to do that. One of the themes that someone mentioned, what if your monster laughs at you?
That's a good question. So, we talk about the symbolic meaning is it being the monster being your problem, right? Your issue that you're dealing with. So, if it's laughing at you, is it something that maybe you felt was solved and is back? Is it something that you're struggling with? Is it that critic voice coming into play? Right? Sometimes we can be our own worst enemy. So is it that critic trying to deter you from the hard work that you are putting in? Those are some thoughts that come to my mind.
Excellent. One person mentioned that maybe they chose violent solutions and weren't able to remember the backpack until a later panel. Um, uh, would you have any comments for someone that experienced that?
Okay. So yeah, those maybe those violent answers originally, working on, if it came up in the first or second or even the third, I guess my conversation then would be, what are some healthier ways to start dealing with those conflicts? But I would also say in that the backpack coming into play later on is probably a good thing, because you did remember the resources at some point. So you have them, they're there. And sometimes when we're angry, we can be very impulsive, where we don't take the time to step back and say, okay, how can I solve this? What are my options? Let me take a deep breath and think about this. Where those resources would identify, would come up into our mind a little bit easier. So working on some of that.
Perfect. I love that. So can you clarify or go over the last picture, what it represents, and what if there's a stranger in the cave with you, but they're not malicious?
Um, I was kind of going backwards. Is the last one the one that's currently up?
I think
Second
just the
part,
last, like the last block,
just the last block. Okay.
I think so, yeah, with in the cave,
Feeling like
with the
you're
stranger.
not alone. I've
Yeah.
had I've had some strangers pop up in that one. Maybe, and they're not malicious. Maybe it's, somebody else who was going on their own hiking journey, happened to pop up. So it could be, a new friend you can make, or somebody that you can talk to about this experience, or just somebody to say, hey, I'm not alone. It doesn't have to be malicious. I talked about it could have that spiritual meaning as well. Is it just somebody who maybe you don't recognize right away but gives you a positive feeling, someone or something? I know. So the things I do with my clients are things that I've done myself, so I know what I'm asking others to do. My first time doing this was probably 10 years, if not a little bit more ago. And in my last one, I had a friendly hiker coming up, as well as um, my husband, who at the time was my boyfriend. So, placing trust in others, in positive people in your life.
Very interesting. So as we come into a close, I had a quick question um, regarding different severities after brain injury. Some people are not able to, functionally move their arms as much, or maybe there's spasticity or anything. Is there types of assistive technology or modifications that can be created for individuals with brain injury to really engage in art therapy, or do you just suggest different modalities? What does that kind of look like?
Yeah, so when I have somebody coming to me, and like I said, in the environment I'm in currently, in particular, it doesn't happen so often. But if somebody's coming to me and they can't, with art, you're using your hands and your arms a lot. If that's something that's not working 100% there's adaptive things that we can do. One of the things that comes to mind is painting, right? Maybe holding a paintbrush isn't going to be so easy. There's a way to kind of makeshift a paintbrush into a tennis ball, right? So now you don't have to grip this tiny little thing, but you're gripping something bigger. Um, there's different ways to use those materials. So it's just coming up with creative ways to adapt the materials to the person's needs. Um, I hope that answers that question.
It does, yeah. Um, in your center, so in the Intrepid Center, do you all collaborate with physical therapy, occupational therapy, and speech therapies? What does that look like? Where does art therapy kind of fit in there, and how do you collaborate with others?
Absolutely. So Intrepid Spirit, we have not only the behavioral health component, which is myself, a clinical psychologist and a licensed clinical social worker. We also have physical therapists, speech therapists for cog rehab, optometrists, the concussion care providers. We have all occupational. We also have some pain assets, so chiro and massage and pain PT and OT. So we have all these different aspects. In terms of treatment, as in the clinic as a whole, we meet together as a team to make sure that everybody's on the same page and collaborating on that person's needs. So something might come up in art therapy that's useful and helpful for them to know. So I'm sharing that information. Maybe somebody's in physical therapy and is having a really hard time because they have a lot going on emotionally and they're not connected to the BH side of things. So, they're referring that person over to us. Even within the little three of us BH team, if somebody is struggling with being very guarded or nonverbal, they might be referring to me to start to open up and do that process. Um, working with a speech therapist, it's helpful to see where the focus and the concentration and the struggling and the issues are there, because we can work on some of that with the art too. One of the things that comes to mind in the moment is, difficulty remembering things. Like if, somebody's asking you to go to the store and get eggs, milk, and cheese, and then you get there and you're not remembering what the heck you're there for. Writing a list can help, but sometimes drawing a list of those things, of what you're trying to remember. Whatever symbol comes to mind for you can actually help more too, because there's that kinesthetic level, the sensory level, the visual level. There's those different levels that you're engaging in that process.
Excellent. Yeah, I like that. The alternative solution.
Mhm.
And so as we kind of finish up, where can people learn more about getting connected with art therapy? Do you have any resources that you like to refer people to?
Yeah, so the American Art Therapy Association is a really good resource. Um, Their website is arttherapy.org, but if you type in art therapy in any of the search engines, they're usually the first one that pop up. They have a lot of good information, resources. They also have a find an art therapist locator. So anywhere in the US, as long as the art therapist is registered with them, they'll pop up. Military side of things, there's a growing number of both art therapists and other creative arts therapists, both in the DoD and the VA, going on, mainly in the Intrepid Spirit Centers right now, but we pop up here and there in other locations too.
Excellent. And just one last one. We have someone here that is an individual living with a brain injury and mentions that before their injury, they were, an artist, a writer, illustrator, very creative, but hasn't been, they don't remember, a lot before their injury, hasn't been able to connect with that passion
Mm.
for creating. Have you seen, participating in art therapy kind of reconnecting with that, or their past, or you know before injury self?
Yeah, absolutely. I've seen a lot of that disconnect between the creative um, passions, whatever that may be. And sometimes the process starts out as frustrating in that what they were once able to do, they're not. So that self judgment can come into play. Um, with the art therapy process, trying to get away from that. Um, and just connect with the materials and connect with the process and connect where you're at is helpful, because whatever your passion and interest is, once you kind of break that ice and get out of that creative block, you can build up those skills once again, um, in whatever medium or material, to where you're at now. So trying to take a step back and just dive into it. If somebody is not feeling so creative, that's what I equate to, handing somebody a bunch of supplies and then just looking at them going, I have no idea where to start. So having prompts or directives can be helpful to get back into that. And then sometimes that starts the wheels spinning and starts the creative process, gets them back engaged and enjoying it again. Some ways to do that outside of the art therapy session, like if you're just trying to do some art for yourself, might be looking up a quote, a favorite quote, or a part of a poem that speaks to you and making some art towards that. Um, in the US, over the last 10 years, adult coloring books has gone crazy. So there's so many different kinds. Mandalas are the circle designs and different themes. So maybe even something like that to kind of get the creative juices flowing and back into some art. A famous piece of artwork that you like and making your own art in response to it or trying to recreate it. Those are some ways to re-engage with the visual arts anyway.
Excellent. Well, thank you so much. I learned so much myself. I hope everyone else did as well. We're getting good comments on really enjoying the activity and all your knowledge. And so, thank you everybody for joining us today. If you have any specific questions or concerns, or maybe need a little bit more unpacking for your activity, you can contact Alice directly. You can see her contact info down on the bottom left here, and she'll be happy to connect with you on that. So other than that, please take the survey. You'll get your certificate, and I hope to see you again for next session. And just really appreciate your time today, and I hope you have a wonderful rest of the week.
Thank you so much, everyone.